Please rise for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, let me just go through the open forum. That'll be next. The open public forum will be placed on the agenda for regular board meetings. During this part of each regular school board meeting, up to 30 minutes of time will be allowed for district constituents to address. No, you don't have anybody? Okay. I guess we don't. Question? Have any then. So,
Question?
Yes. Yes, Jill.
Will there be any staff reports or board reports tonight that will be given during the open forum rather than at the board table?
We'll give them during the, when we have our regular board report or staff report. That's when they'll be given.
Thank you.
Okay. All right. Okay, celebrating our community successes. Mr. Dibble, I believe you got a Military Family Appreciation Month.
We did. Are any of them left? I think we should table that till the next meeting.
Okay.
They left while they were waiting.
Do that.
Thank you.
Oh. Point of order.
Okay.
Is there an open forum or no?
There is no one signed up, Jill.
Okay, thank you.
Yep, sorry I didn't answer that before. Okay, number 5 then, celebrating our, I'm sorry. Oh, okay, hold on, there might be one yet.
Yeah, it looks like they signed the people here sheet instead of the public forum sheet, but there are people who want to speak.
Yep. Oh, sure. I'll wait. I'll continue to read this, and if it looks like we might have someone to speak, each person is asked to identify him or herself by name, and if they represent an organization, to name that group. Remarks should be addressed to the board as a whole. Each presentation may be up to 2 minutes in time. The school board will not hear complaints about individual school employees or permit discussions of such matters in an open meeting. No response, reaction, nor action shall necessarily be taken by the board during the open forum portion of the meeting, and the school board will take no action at a meeting on an issue raised for the first time by the public. Okay. Did we get some then, Ashley? Okay. Yeah, Jill, looks like we'll have some tonight. All right, so I can just call him. Okay.
Yep.
All right. Nick, come on up. You're the guy on the list, so.
I don't know if I need that thing. So a little bit of what happened here tonight is kind of what my concern is. I attended the November 1st meeting, and I did not have a mask on, and I wasn't the only one. And not at any time was that issue addressed by anybody at the board table. And I'm sure everybody knows by now that was not the case. On October 4th, when the meeting was delayed as it was tonight, until the community members complied with the mask mandate or were asked to leave the room. So that leads into my question, because there seems to me to be an obvious case of inconsistency of the policies being enforced. If there's masks are supposed to be here for safety, then apparently there was no safety concern at the last meeting. So my question to the board is this: why is there such a contrast between the policies between the October 4th and November 1st meetings? And further, after the meeting on November 1st, while I was in the hallway, I would like to know why a member of the administration decided to address me individually about the mask mandate. From what I have looked into and what I understand, it seems that board policies were probably violated, and I will be inquiring about that. I will formally send the board my questions along with my inquiry to the policy violation, because you just stated that members of the board are not going to discuss policy with community members at the meeting. So I look forward to the responses to those questions. That's all I got.
Okay, thank you. Okay, then we will, we tabled number 4, the celebrating the Military Family Appreciation Month. Number 5 is celebrating our district successes. 5.1 is the August 2021 Employee of the Month, Ed Chapman. And that's for Kathy.
Well, everybody, this is one of our custodians. Currently works at Southwest Middle School. His name is Edward Chapman. And he has been nominated a couple of times, and so we're very excited for him to receive this award as our August 2021 Employee of the Month. Let me just read you a little bit about what was said about Edward. He has worked for 3 years with the district since April 2018. Edward constantly goes above and beyond. He will drop everything to help you, even though he is constantly busy. He tells me frequently that he loves to help people, and he is always there for a chat or a pick-me-up conversation when it is needed after a long day. Edward is 1 in a million, and Albert Lee is so lucky to have him as a custodian. He deserves this. And I will tell you, our custodial staff has worked above and beyond over the last 18 months, and Edward's work and his just really built a lot of collegiality with the staff at Southwest Middle School. Just really is a testament to all of the work of our custodians. So I want to take this opportunity on behalf of our HR department and the staff that nominated Edward to thank him for what he has done and show our appreciation as a school board and as a school community.
Thank you.
Thank you, Edward.
I just want to say a brief moment here. I don't know if I have time or not, but I just want you all to know that if you do see a custodian wearing a mask or not, tell them thanks. Give them a little credit, because we do work hard. And sometimes we don't, but most of the time we do.
Most of the time you do.
Especially when you got little ones that leave marks and handprints all over the place. Thank you.
Thank you.
We
All
do
right.
have 2 other employees of the month, and we'll address, one could not make it tonight due to a family obligation, and the other one did leave early, and so we'll address those at another board meeting. But thank you letting me address this tonight.
Thank you. Okay, number 6 is approval of today's agenda. I'd look for a motion to approve.
I'll make a motion to approve, but I would ask that we add an item to discuss if this is how we want to start our meetings out.
What item is that?
Well, we could put it wherever, but just a discussion, possibly a vote, just to see if this is how we want to start the meetings and if this is how we want to enforce the mask mandate to this level.
Where would you want to add that at, Angie?
We could do it at the very start if you want, or the very end.
Why don't, let's put it at the end. And what would you like to call that? Just a masking discussion?
Yes.
Question?
Yep, that'll work.
Good, okay.
Sorry, I couldn't hear all that. Maybe if everybody could please use your mics tonight. So what are we doing right now?
Just Angie asked to add 11.4, a masking discussion.
All right, I would also like to have an item moved from the consent agenda.
Which one is that?
Do we need a
I believe
second?
it's 7.5.
Get a motion for this one, and then you have to add them separately.
Okay. Let's get a second on 11.4.
Second.
I second.
Okay. So we got Kim and, okay. And then to remove 7.5.
Angie, when you initially introduced this motion, you expressed that the motion be in regard to how we start meetings, and now I see it's about masking those switches. Is it about how we start meetings, or?
Well, I guess, I'm just wondering if the board wants to engage with the public this way at the start of every meeting. I don't know if this is going to keep happening, but, you know, I just wonder if maybe we're taking it farther than all of us would like it to, and I think it might be worth visiting about.
So your original statement was more accurate than how we deal with the beginning of the meeting?
I guess, how do we want to enforce the mask mandate within the meetings?
So now it's more on masking than how we start a meeting.
But it's both, yeah.
Okay, it's a bit vague.
So does that include what we do prior to the meeting start as well? Sorry, I still can't hear very well.
That's what I had in mind, yes.
Okay. So it's more the beginning or the enforcing of the mandate, okay? You still want to second that, Kim, since you were the first? Okay. Kim removed her second, but Jill, you had also mentioned?
I will second if a second is needed.
Okay. Yeah, Angie made the motion. Yep.
So you'll need to
Okay.
take a vote on that, adding that.
And then 7.5.
Chair Clot, we need to,
Oh,
You
we'll
need to
need
vote
to
on
vote.
11.4
we need to vote on that
first.
one
Oh,
first. and
Yeah, I
then-
thought it was just at 2. All right, so we'll vote on adding the enforcement, the beginning of a meeting, masking discussion. All those in favor signify by saying aye.
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 And oppose the same?
Nay.
Okay, passes. And Jill, you'd asked about 7.5.
Yes, I'd like that removed from the consent agenda, please.
Okay, is there a second on that?
It's not debatable. It's
Yeah.
not debatable.
Okay,
Is it moving to the agenda then?
so then it'll go to the agenda, correct? Discussion, yep. So that would be under, out of consent. Let's put that under, I guess 11 point, I'll put it on the end then, I guess, 11.5. That was 7 point, okay,
Thank you.
Dave, I can address that
okay.
at that time.
Kathy will address at that time.
Kathy, yep, you will go through it, yep. Okay. Any other comments on today's agenda?
Dave, at 5:45, that person is going to zoom in. And so
What's
wherever
that,
we
sir?
are on the agenda, we should move that person from Mayo up to that spot.
Well, we'll, that's a good point, Mr. Dibble. He's supposed to come on around 5:45, correct?
Right, yep, that's what we have.
So
him
we
scheduled for.
will watch, well, he'll be in a holding area, I guess. Okay, so when we get to that, it is listed as 9.2, but in respect of his time, if we need to move that, we will move that to when he can speak for about 10 or 15 minutes, okay? And he'll be zooming in with us, so, okay? Any other? Okay, so we get those changes. All those in favor signify by saying aye. Pose the same sign. Okay, so with those changes, the agenda is approved. Consent items minus 7.5, I would look for a motion to approve all of them.
I'll move to approve the consent items.
Okay. And Bruce second, okay. Any other discussion? Any discussion? Seeing none, all those in favor signify by saying aye.
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 And oppose the same. Okay. We'll move on to number 8.1. Mr. Dibble, do you have a report?
Yeah, I have a quick report today, not superintendent related, but principal related. So Mike wanted me to give you kind of an update on how the teaching staff is doing, and it's been a tough year. And part of that tough year is just, getting back into the swing of things and a real lack of, like Kathy's talked about at other mornings, that there's a lack of subs, and our teachers are absorbing a lot of time. We kind of thought we were alone. I think the teachers and principals have been kind of quiet because, we're doing our jobs, we're doing the best we can to keep students in school and doing everything possible. But a Star Tribune ran an article in the last couple of days here, and it's statewide. And it's not only statewide. I was watching Facebook today, and one of my good friends from high school, who actually lives in South Dakota, just asked today, what can I do to get out of public education? I'm not whining. I'm not complaining. We have jobs. We're doing the best we can, but it's a tough environment to teach in. And so I just wanted to share that with you guys to know that like Edward said earlier, the custodians, the teachers, paras, EAs, administration, you guys are all doing what we can to make things work. And as we look forward at making things better, we're going to try some different ideas. We'll bring them to you for support, and we're just going to do what we can to keep this going. But recognize that it is a tough year, and for teachers in particular, the time that they've given up, giving up those prep times for subs has just been really tough. So we're going to keep pushing ahead, but I want everyone to recognize that we see the struggle, we feel the struggle. Even with you guys, what you're going through I feel the struggle with you as well. So I appreciate everything you do. I appreciate what you do. I appreciate what the parents do. I appreciate what the students bring to us every day. And we're going to keep going forward, but we may need to look at some things to ease some of the stress. So that's all I have for tonight. Thank you.
All right. Thank you. All right. School board member reports. Let's start with Bruce.
No report this evening.
Okay. Thank you. Neil?
Yeah, I subbed a week ago last Friday, so I can second everything that Chris stated. Actually, though, my experience wasn't bad. I had 5 classes of English students in high school, and everybody's desperately concerned about the masking issue. They all had masks. One student was not wearing a mask, and I asked him about that, and he said he had a medical dispensation, and the rest of the students were very eager to chime in and say, yeah, that's right, he does, so he's okay. The mandate or the protocol, mitigating factor, whatever you want to call it, about masks is another stress item. As Chris pointed out, it's been a stressful year for staff. There have always been rules that teachers are charged with enforcing that make the job difficult. It would be nice if we didn't have those rules and those unpopular mandates to enforce, but the world doesn't work that way, and they're necessary. And my experience with students involving masks was congenial. There are always students, kids that would like to push your buttons and see how much they can get away with, and so they'd wear their mask, down under their nose. I'd take my mask and go up and okay, no problem. Didn't have any trouble at all. In fact, I was kind of expecting a sort of hostile environment, but it wasn't there. At least not in the classes that I had. I was there for one day in one class, so I didn't see the whole high school. But what I saw wasn't bad. Having said that, I totally concur with what Chris pointed out, because I'm not that far removed from the faculty, and I talk with a lot of faculty members, and it's a war zone. I mean, there are so many dynamics involved that are making the job difficult, making it difficult to present an educational environment this year. And we just witnessed, quite frankly, an example of that tonight with this culture that we have created somehow that seems to be against just about everything. And instead of joining in and asking how can we contribute to a solution to this, throw gasoline on every fire and try to make things as miserable and as difficult as possible. And you forgive me for being a little bit impatient, but it affects all of us, not just teachers, students, administration, board members. It's stressful for everybody, and it's not necessary. It's something that's so easily avoidable if we would just get back to cooperation and working together instead of tearing each other apart. It's just totally unnecessary. Forgive the sermon. I had another great experience last Friday. Went to the fall musical. We are noted for having outstanding theater productions, music productions, and this was no exception. It was good, great. Mamma Mia! If you missed it, you shouldn't have. It was what's called a jukebox musical based on a 1975 album by ABBA with the same name, Mamma Mia. If you like ABBA, you would have loved the performance. It was awesome. Today, I met with a group at the high school involving scholarships, and Kim is very involved in this program too. And we're both on the Education Foundation of Albert Lee, and the foundation serves as a custodian for a lot of scholarships. Not all of them, but it's important that we get acquainted with the high school and the administration of these scholarships, which are presented at the awards assembly in the spring. So that meeting went very well. Thank you. That's it.
Thank you. I attended the policy committee meeting, and we had some version issues, so they're updating the versions and then we'll meet, but I think tonight we're on a third reading that we'll talk about. On September 21st, I forgot to report this in October, I was actually asked by Riverland to represent school board members on the PSEO concurrent advisory for Riverland. Those are the 9 partnering schools in the collaborative, the consortium, I should say. And so they have 1 school board member, so Albert Lee gets that this time. So that's decided by them. And so it's really good because it keeps us connected. Jeff Halverson with the district is on it as well, and very informative, and it's going to be a great advisory to be part of. I think Angie and Dennis will touch on the other meeting I attended. It's the Business Ed Committee, but I just wanted to point out one of the pieces we talked about was unemployment and the lack of jobs and how that works. And so it's unemployment is down, and that affects people going to school, to colleges, people, it affects those pieces too, and it also affects the workforce, and so we definitely have workforce issues. So that's just something I wanted to point out today, and I'll let you guys talk about the other stuff if you want.
Yes. I also was at the policy meeting. I did want to put out a kudos to the cross-country team. It was great to see that happen, and the amount of time and effort that Jim Haney's put in to work with those kids. I also was able to have a meeting with Jim Haney and Brittany Utska talking about youth in government and doing some planning work there to help those students out that have an interest and hopefully develop that. Business education, we talked about, we did have the manufacturing week. It kind of went a little quiet when they had it, but a lot of good things were happening there. Leadership Reads continues. We talked a long time about job opportunities and work with the kids, Future Forward, the unemployment rate. Talked about the child care issues and how the state is still looking at trying to help out families with the child care before and after school. Nothing to report on Perkins. I also sat in a really good meeting on Chamber Governmental Affairs. The reason I bring that up is we had, I'm trying to blank on who was there. It was Philip Johnson from the Alida, and they were talking about looking at developing educational scholarship for kids as well. I'm guessing you're probably going to hear about it at Educational Foundation, but they want to tie in with the Chamber as well, because the Chamber does some scholarships, how they can work with some of the students that might be looking at technical or more local college level and then get into the manufacturing field, how they can work with them, potential for some 50% reimbursement and things, but I know that we'll be hearing more about that. So another opportunity to help some of those high school students as we move along. Did want to thank the community for the support of the referendum. I think that's going to be very important for the community moving forward with all the different issues going on and our ability to serve and meet the needs of the students. And then also, congratulations, we did have the Superintendent of the Year. Again, during these challenging times, I think that's some very positive.
Thank you, Dennis. Angie?
Is this on? All right, I attended also the Business Education Committee meeting with Dennis and Kim, and you guys touched on it pretty thoroughly. In my notes, I had written down that most of the usual activities we get updates on are on hold right now for COVID, but we talked quite a bit again about the unemployment situation that is ongoing, and also newer this time we talked about how the potential OSHA vaccine mandates might further affect that. So that's what I had, and I think we skipped Jill on the way around. So,
Jill?
Thank you. And I would like to note the latitude that was afforded to member scores. So I would appreciate the same latitude and not to be shut down as I have in the past. I attended the alcohol, tobacco, and other drugs meeting, talked about some e-cigarette issues and funding issues. I also attended the policy committee meeting where we talked about policy 613, graduation requirements, and 620, credit for learning, and those should be coming to us at a future date. I want to say that I object to the way that the beginning of this meeting was handled because of other precedents that have been set around the district, and I know that we'll be discussing this later, so I appreciate that opportunity. And I wanted to ask the superintendent, but he's not there tonight. In his October 22nd update, there was a statement, a board member has inquired repeatedly at board meetings about placing items on the agenda for our meetings. We have a process in place for that. It is in policy 203.5. So I was wondering who was being referred to there, because it certainly isn't me. I have not been inquiring repeatedly. I requested in an email on September 27th that policy 201 be brought to the board, and Member Klott, you are also aware of that since you were also on that email, because all we need to do is, of course, bring our requests to either the superintendent or the chair in a timely manner. I've heard nothing of this yet. Also, in the open meeting of October 18th, I requested that we review policy concerning having open forums at our workshops as well. And Member Klott, you were also there. You're aware of that, and it was in the minutes as well. So those were both done. Those were both appropriate requests for items to be placed on agendas. And then this update came out on October 22nd. Also, referring to my report from October 18th of unanswered questions, I still have unanswered questions a month later, and at that point they were late. So I'm wondering, when might I receive answers to my questions?
Okay, thank you.
And that's a question.
We don't discuss,
When-
we
when
need time
might
to
I-
work on those, Jill. You know that.
Excuse me?
You'll get your responses. We need time to work on responses.
How much time will you need to work on these responses?
Okay?
It's been months already, so I'm just wondering,
It's-
does everybody else wait months to receive their answers?
2000, we're not going to discuss it. This is your time just to report on what you've done in meetings.
Oh, well, that's not what Mr. Score was allowed to report on. This is official school board business. I'm asking an update because I'm not receiving any communication outside of public meetings. So this is why I'm asking these questions in public meeting.
You will receive those questions when they're ready to be answered.
When will that be, do you think?
Not positive.
Thank you.
You're welcome. Is that all? Okay. I didn't have anything, meetings. I did want to mention, as Dennis did, the cross-country team going to state. Mrs. Haney and everyone that did the wonderful play. I believe it's our 26th one to see. As Mr. Score said, too, an opportunity to speak at a class at the school here within the last month. And it was interesting, but I saw no problems anyway in our classes there with anything with the students. And then want to congratulate Dr. Funk for the first superintendent of the year from Albert Lee and from the Big Nine Conference. All right. Teacher report. Corey Elson. Yeah. There you go.
I would just like to say thank you very much, Mr. Dibble, for bringing out the points that you brought. There's been many discussions in our circles with the very same sentiment. I'd also like to kind of go back a little bit too. There was an awful lot of work that was put in by many of our staff members in District 241 for the phone banks for the referendum and connecting with the community members. There were people from every building that gave of their own time to connect with community members and get them out to vote for or against the referendum, just getting them out to vote. And a special shout out to Beth Isaacson, who was the kind of the fearless leader of that group of people and making sure that things were taken care of on that time. She put in an awful lot of time, and I know it's not always thanked nearly enough for things like that. So kudos to her and everybody that put in that time. Thank you.
Thank you. Yes, Ashley is our Dr. Bachra. Okay, there we go. Well, thank you for waiting, Doctor. Can you hear us?
Yes, I can. Thank
you. Okay. Go ahead. We appreciate your time, and we look forward to hearing what you have to say.
Well, first of all, thank you for the invitation. I do see some familiar faces. I'm representing Mayo Clinic Health System in Albert Lee and Austin, and with me is Ilya Hopkins from Community Engagement. She'll be running the slides, and I've been told I have 10 to 15 minutes. We did prepare for a slightly longer presentation. We'll rush through the presentation and send the slides as PDF attachments for you to review later. Before I begin, I'd like to congratulate Dr. Funk. I know he's not here today, but being recognized as the Superintendent of the Year for the year 2022 for the state, and then also getting a slot at the National Recognition Forum in February is a great deal. This really puts Albert Lee at the national map, I think. And it's thanks to people like Dr. Funk who support the community as well as support the Mayo Clinic Health System Board that we work together stronger, and it makes our community stronger as well. So without further ado, I'll jump right into our slides and provide a brief overview. If people have, paid attention to media and current affairs recently, all this is not new to you at all. So Sumit Bagra, I'm the new site physician lead for Mayo Clinic Health System in Austin, Albert Lee. With me is Ilya Hopkins. We are so excited to present to the school board today. Next slide. Just to reiterate, our common goals obviously are safety of the students. We fully understand that in-person learning is the desirable or the preferred way of learning. That's how children learn. And that the health and wellness of students, staff, families, and community is first and foremost in how we plan things and how we maintain safety in our communities. Next slide, please. So some of the topics we'll talk about are COVID myths or misconceptions, as I call them. I don't plan to be the myth buster here, just provide some good information. Talk about the Delta variant, keeping students, staff, families, and communities safe. Talk about vaccines and open it up for questions or present, send the slides over to you and really have the school board determine what the best way to take questions or answers would be. So the first myth, children do not get infected with the SARS-CoV-2 virus that causes COVID-19. That could not be further away from the truth. Children from all ages, months old to 15, 16-year-old, they do get infected, and some of them actually end up in the hospital with a severe form of COVID-19 called the multisystemic inflammatory syndrome of children. So there have been deaths reported in children as well. Fortunately, children do not fall or do not develop severe COVID-19 disease very often, but it does occur in children not too uncommonly. The second myth, children do not need to be vaccinated for COVID-19. COVID-19 vaccines are available for children, recently approved for the 5 to 11-year age group as well. They are safe and effective for children. The third myth that's also quite common for adults is that folks who've had COVID-19 in the past do not need to get the vaccine. Now, that might be true for the first 60 to 90 days after the infection because natural immunity probably lasts at least 60 to 90 days, but reinfections are common. And we know that vaccination immunity is perhaps more robust and leads to higher antibody levels and perhaps longer protection than the actual infection. Early on, we thought that the vaccine would provide long-lasting immunity. It seems like it's probably 6 to 9 to 12 months long. And we've had some breakthrough cases with the COVID-19 vaccinated individuals as well. The second or the last question that comes up often is children who turn 12 next year should wait until they can get the real dose, quote unquote, real dose of the vaccine, because the vaccine approved for 5 to 11-year-olds was 1/3 the dose. The truth here is that the dose was tested based on children being smaller in size and smaller in body weight. And that dose results in a robust immune response. The longer we wait for children to get vaccinated, so if they turn 12 and there's 8 or 9 months until they turn 12, we are potentially exposing children to a period of susceptibility and they could get infected. If 1 in, say, 1,000 kids develops a very severe syndrome and gets hospitalized or has a very bad outcome with the disease, we're potentially opening up the window for that child to get infected as well. So get the vaccine when it's available, obviously after the parents have had a chance to talk to their physicians, as well as to the child as well. Next slide. So the Delta variant, we started with the Alpha variant, the original COVID-19 virus, and the Delta mutated to a variant that is much more transmissible. Some studies show up to 225% more transmissible than the original virus. And that's to do with how tightly or how effectively it connects with some of the receptors in a person's nose and throat. Delta also tends to have higher levels of viral activity in the throat. So when people speak or sing or talk or eat food, they are more likely to emit those particles out. Whereas the original variants somehow existed lower down in the respiratory tract and were not as transmissible. Unfortunately, people who get exposed to Delta experience slightly more severe disease, and there's a greater likelihood of hospitalization. 90+% of all isolates for COVID-19 end up being Delta. When a person gets tested, say at a Mayo Clinic site, we don't typically test for which variant it is, but some of the samples are sent over to CDC and MDH for surveillance to see what percentage of samples show up the Delta or the other variants. The risk of severe disease or dying is 5 to 10-fold higher among the unvaccinated compared to the vaccinated. What has that meant for Mayo Clinic and the communities we serve? We've had times where more than half of the patients in the ICU have been COVID-19 patients, requiring intubation, ventilation, and sometimes spending up to 2 weeks in the ICU before they recover. In some cases, because of the dearth of beds, we had to pause elective surgery or free up staff to channelize them to the emergency department and inpatient care. And that really affects elective care, elective surgeries that our loved ones are looking for. So as the hospitals fill up, we have to balance the elective surgery, elective care with emergency surgery we provide for COVID-19 patients. We continue to provide evidence-based information about masking, vaccines, quarantining to any local bodies, school districts, city governments, employers, as the needs arise for those types of requests. So we do know what works to reduce spread. It's, I'd say I'll start from the most basic first. It is hand hygiene to make sure that we're not touching surfaces and picking up the virus that then transmits to our mouth, nose, and face. The second in importance would be masking and social distancing. The third is isolating when sick and getting tested promptly. And vaccination, of course, is one of the key strategies in our armamentarium to protect people from getting infected. While it is true that people who are vaccinated can get infected, vaccinations are not 100% effective, but they do reduce the risk of severe COVID disease and make death from COVID-19 highly unlikely. Next slide, please. An interesting study from Arizona and Maricopa and Pima counties that looked at schools who went masking optional from the time the school started versus schools that had mandatory masking from the get-go. The schools with masking optional policies tended to have 3.5 times higher likelihood of COVID-19 outbreaks, as defined by at least 5 cases in a school that occurred after schools opened up. So masking in the school setting actually works to decrease the risk of focal or local outbreaks. Next slide, please. COVID-19 vaccine, we are fortunate to have 3 different manufacturers with approved vaccines in the United States. Pfizer, Moderna, and Johnson & Johnson, they've all entered modern vernacular and people pretty much know all the brands and the type of vaccine they've received in the past. Fortunately, all these vaccines are highly effective even against Delta, although they were developed in the time that Alpha was the predominant variant. These 3 vaccines are highly effective in preventing severe disease and death. We also have third doses available for the Pfizer and Moderna for people who are immunocompromised. I'd like to make a difference between the booster terminology that we use for people who've been vaccinated and receive a third dose down the road to boost pre-existing immunity versus a third dose given to immunocompromised patients, because we feel that the first 2 doses may not have resulted in an adequate enough immune response, that the third dose really forms a completion of series for them. So people who've had transplants or immunocompromised or on certain medications really require the third dose to maintain a good immune response against COVID-19, whereas people who are not immunocompromised may require a third optional booster dose to boost pre-existing immunity as the immunity levels wane with time. COVID-19 vaccine now is available for ages 5 to 11. It's the Pfizer that got approved for that age group. I believe Moderna has applied for approval as well, but that decision has not been made yet. Next slide, please. So COVID-19 vaccine for 5 to 11-year-olds, it is now available, approved. The actual dose injected is 1/3 of the adult dose, but is given in the same way. That is a 2-dose series given 3 weeks apart. In clinical trials, the Pfizer COVID-19 vaccine was at least 91% efficacious in children age group 5 to 11. Next slide, please. Another question that comes up is, if you've gotten vaccinated and vaccines were promoted as something that would prevent COVID-19 infection, why do I still need to wear masks? It is, of course, frustrating that we have to wear masks despite getting vaccinated. And the Delta variant, being much more transmissible, infects people. So people with COVID-19 vaccination can potentially get infected. No vaccine is 100% effective. In fact, when people get vaccinated, they tend to have higher risk behaviors sometimes, such as going to areas that are heavily crowded or attending venues with thousands of people in there. And the real world effectiveness of the vaccine can diminish simply based on the types of behaviors that vaccinated people might engage in. Overall, vaccination remains highly effective in reducing severe disease and death, but breakthrough infections are possible. The other reason to wear a mask despite vaccination, for example, in the healthcare field, Despite me being vaccinated, I would wear a mask to protect my patients or children that I see, or folks who might be immunocompromised, because I might come into work and be infected that day without any symptoms and not knowing that I have the infection. If I were not to wear a mask and I spent 15, 20 minutes with a patient in a room, it's possible that myself being vaccinated could potentially spread the infection to somebody who's susceptible. Next slide, please. So I'm not going to belabor the school exposure guidelines for quarantine, but I just wanted to make the point that the CDC does not consider two children that are within 3 to 6 feet of each other. If they were wearing a mask and one of the children is infected, that is not considered a close contact. So if schools potentially had masking for all students, and even if one of the students was positive that day and spent time with another student, potentially you could prevent quarantine for the exposed students unless, of course, they became symptomatic. So if universal masking is only suggested or strongly recommended but not required, a student who has had close contact exposure would therefore quarantine. And if an outbreak did occur, that could potentially disrupt in-person learning for a large number of students as well. Next slide, please. The vaccine appointments are available at Health Reach in Albert Lea. They're also available right after a medical appointment if supplies are available. Mayo has been contacting and reaching out to patients who are eligible for the vaccine. Appointments can also be made at the vaccine clinic by calling the number listed on the screen or by sending a portal message to your primary care team. Just as a reminder, any person who is younger than 18 needs to have an adult parent or guardian with them to receive the vaccine, as patients who are not adults cannot typically consent for a vaccine. Other options for vaccine, Freeborn County Public Health is hosting clinics, the first dose clinic on November 18th and corresponding second doses given on December 9th. A second clinic will be held on November 22nd with the corresponding second dose given on December 13th. Some local pharmacies are also able to administer the vaccine for 5 to 11-year-olds. So vaccination can be hard for adults, and I can only imagine how a 7, 8-year-old who typically does not like vaccines might process the information that they're now ready to get the COVID-19 vaccine as well. So as parents in the audience, talk to your children before the visit about what to expect. Prepare children for possible side effects, which are a normal sign that the body is responding to the vaccine and making antibodies. Common side effects include pain, redness, swelling at the injection site. The child might feel tired for a day or two, headaches, muscle pains, chills, fever, nausea, and provide words of comfort and actions to their children during the appointment so that they may go through the appointment without too much discomfort. Next slide, please. The Mayo Clinic website has great information. We've highlighted some of the common questions that people ask. So COVID-19 vaccination questions answered, conversations when kids test positive for COVID-19, symptoms to watch out for, ending the pandemic of misinformation, misperception, how the COVID-19 Delta variant impacts young people, and talking with their children about vaccines. Next slide, please. So the positivity rate, despite all our best efforts, remains high. For Mayo Clinic tests run on Mayo Clinic patients as of Sunday, November 14th, Southeast Minnesota, which includes our Red Wing, Owatonna, Albert Lea, Austin locations, had 18.5% of all tests that were run came back positive for COVID-19. Rochester positivity rates have generally been lower than Southeast Minnesota, but they used to run 2 to 5%, gradually inched up to 10%, and now Rochester is showing a higher percentage positivity rate as well, of approximately 13%. These are some of the highest numbers we've seen in Rochester in the last 3 to 4 months. There's lots of sources of information, but CDC, and if you search Google for COVID-19 stats for your county, the CDC data shows up as the first hit on Google as well. The data for Freeborn County shows high community transmission, 383 cases per 100,000 people, average percentage positivity of 10.1%. Fortunately, there have not been any deaths over the past 7 days. Percentage of population older than 12 fully vaccinated, 60%, and new hospital admissions over the past 7 days, 11. I'd also like to add that we've given more than 1,000 monoclonal antibodies in the Albert Lee area to people who've been infected. And those vaccines, sorry, not the vaccine, but the monoclonal antibody limits the progression of COVID-19 to severe COVID disease. And we'd like to think that all the work being done by Mayo Clinic Health System in Albert Lee has proudly prevented many people who were unvaccinated from being hospitalized or being ventilated or ultimately resulting in a fatal outcome. So lots of work being done, but there's a lot of burden of disease that our infusion therapy nurses are handling 7 days a week in the Albert Lee location. Next slide, please. So vaccine data, who's getting vaccinated? The red vertical line shows the state average, 63.5%. Freeborn County, approximately 55% vaccination rate. Some counties, of course, have beat the state average, but most range between 50 to 55%. People who've completed the entire vaccine series in Freeborn County, 53%. And as you look at the bottom, the different age ranges, obviously the 5 to 11-year-olds, only 4% have received their first shot because the vaccine literally just became available. But as we look at the 12 to 15s, 16 to 17, 18 to 49 age group, vaccination rates barely reach about 50%. As we get to 65 and older, our vaccination rates are 84%. If we look at some other counties, in the 65 and older population, we've reached about 90% vaccination rate as well. This results in a total population vaccination rate of 54% for Freeborn County. Next slide. As we look at the public health data, looking at total lab confirmed cases in Freeborn County, 286 for the past 2 weeks. School age positives, assuming that anybody younger than 18 probably goes to a school in that area. So looking at their zip codes, total cases 53 among school age children, predominantly in Albert Lee, given the largest population in that zip code, but there's a smattering of other cases spread across different zip codes here as well. 18% of all cases reported in the last 2 weeks were in school-age children. A couple of weeks prior, that percentage was slightly higher, about 20-25%. So the overall percentage of children infected is slightly lower in the last 2 weeks, but that's 1 in 5 people getting positive that belong to the pediatric age group, younger than 18. Next slide, please. So that was a very quick rundown of 22 slides in hopefully less than 10-15 minutes. And I look to the board here to decide how much time we have and how to run this going forward.
Thank you, Dr. Bagra. Are there some questions?
I do have some questions, but I have a list of them. I'm happy to go after anybody else who has questions. I just didn't want to be forgotten, so.
Neil?
Yes, how do our occurrences compare currently to what they were at the height of the onslaught of contagion last spring and winter?
So if I heard the question correctly, how do the current numbers in the county compare with the onslaught that we had from the Alpha variant last spring, correct?
Right. And winter.
Spring and winter.
So what's happened over the past 12 months is that on one hand, we have 50 to 60% people vaccinated, but we've also got people who are rightly sick of this pandemic that has gone on for too long, 18 to 24 months, approaching about 2 years now. So some of the masking, et cetera, has obviously become lax and not pointing any fingers at people. So behaviors have changed. People have gotten vaccinated. Plus, there's a Delta variant that is much more transmissible. So overall, if I were just to look at the broad picture, I'd say the numbers of positives that we're seeing now are about the same as we were at the height of the contagion previously. The one thing that has changed in Freeborn County as well as across the nation, across the state, is that there are less number of people dying and a smaller percentage being hospitalized. So you might have a large proportion of people getting infected, but what proportion end up in a hospital or what proportion end up dying is a much smaller number because the vaccine has that positive effect on the population. So it depends on what numbers you look at. Less deaths, about the same infections, and slightly lower proportion of people ending up in the hospital, which is kind of a good news, bad news. We would love to have seen lower numbers and a very low proportion of people being hospitalized as well.
Thank you.
Situation is still concerning. I know that some of the neighboring states are looking at delaying, postponing elective surgeries. I heard of some school in Rochester that's going back to remote. It's not one of the major schools. So it is not out of the woods yet. In fact, some of the numbers keep coming up and we do wonder where the transmission is occurring because we'd like to think with 50, 60, 70% vaccinated, we would have seen much lower numbers. But it's really increased protection pitted against a much more transmissible variant and perhaps some laxity in safety measures as well because frankly, they do get old after 18 months.
Yeah, Dennis.
Just a curiosity, individuals who have had the virus, what's the likelihood of getting it again? Are we seeing that happening a lot? Because the reality would be that once they've had it, we should start seeing the number of infections going down substantially.
Right, so we've seen, I have seen reinfections in my clinic for sure. We've had some people who've had it 3 times in a row documented. So if immunity lasts about 6 months, and this really started in Minnesota March 16th of 2020, we've had approximately 18 months elapse and some people infected already 3 times. We're also seeing that vaccinated people approximately 9 to 12 months later can develop mild reinfections. Just as an anecdote, if we look at the patients in the ICU, and I'm not speaking about certain hospitals or disclosing data about Albert Lee Austin Hospital, but in general, if you look across Minnesota and you look at patients who are infected and have a fever or a cough, there could be 60 to 70% people who are unvaccinated and about 20-30% people vaccinated that fall in that bucket of being admitted to the hospital with mild to moderate infection. But if you look at the ICU where people are intubated and fighting for their life, the numbers generally tend to be 90 to 100% people unvaccinated who end up in that situation. So it appears that the vaccination really prevents and bends the curve towards less severe disease, and the unvaccinated people generally end up with much more severe disease, end up in the ICU, and sometimes spending weeks at a time fighting for their lives in the ICU setting.
Do you find with the repeat infections, and it possibly is, as you just said, with the unvaccinated versus the vaccinated, but what do you find with the severity of the repeat infection?
So that question has come up, and I don't have actual data to say if a repeat infection ends up being less severe, what the likelihood of the person ending up in the ICU is. I'm sure that data is out there. We could certainly look that up and send it back to the board as well. Because really the question boils down to natural immunity protecting compared to vaccine immunity. We do know that the vaccine results in a much higher antibody level. So I don't have that data off the top of my head.
Okay. Would you like to go, Angie?
All right. First of all, thank you so much for coming, Dr. Braga. This is great. It's awesome to have you as a resource to ask questions to. I have a few questions about just what's happening locally and then a handful more just about the vaccines too. But I was wondering, could you talk a little bit about what's happening with the local hospital bed situation or the ICU beds? I mean, I know we don't have a hospital, but I hear that there's a bed shortage. I'm just wondering what are we seeing and what are the factors there?
So there was some static right when the question was being asked, and I think I got the sense that it's about hospital bed situation locally.
Yes.
Right. So over the past 3 weeks, I'd say we've come very close to the hospital being full to the point of asking, do we have enough capacity to take care of all the cases that were scheduled for that day? Fortunately, over the past 3 weeks, we've not had to cancel any cases, but we've been, bursting at the seams with patients, 50+% of patients in our ICU being COVID-19 patients. And I'm speaking about the Albert Lee Austin setting. Fortunately, we've not had to delay or postpone or cancel any elective care that was scheduled, but we came pretty close over the past 2 weeks or so. You may know that about 6 to 8 weeks ago, we did have a pause on elective surgery for a few days because of staffing and beds, but that was just thankfully a short-lived situation. So we are close. It's not that we have redundant capacity or open beds. Just to give you an idea, some days we discharge half the hospital, and by the night, those beds have been filled up, approximately half by COVID patients and half based on other medical conditions that come in. So our staff are doing a great job. Immense gratitude. Many have not taken vacation because of short staffing. Folks are just working extra hard. We've had clinic doctors helping out in the hospital as well. So overall, all hands on deck. And fortunately, we're not in the situation that we saw New York City in and some other larger cities in at the beginning of the pandemic, where some of the healthcare delivery system did not work as designed. So we're getting by so far. But we are concerned about the future if the cases keep going up or the vaccination rates do not go up, especially among some of the 50, 60, 70-year-olds, because age is one of the risk factors. I also have to mention that children, although they don't get severe disease that often, they oftentimes become the portal that takes the disease home, which then in a week or two affects their parents. And a week or two later, come Thanksgiving, come Christmas, when the parents go visit grandparents. So what we see 3-4 weeks down the road might be what happened or started in a school. So it's very hard to make the connection because we think of age groups as siloed, 5 to 11-year-olds don't get infected, therefore why, do X, Y, or Z. But what starts in the 5 to 11-year-old group a month or so later ends up with the grandma being infected and admitted to the ICU. So we're just worried about the continuum of how this spreads and breaking the chain of transmission across the community.
Okay.
Angie, can I piggyback on one bed
yeah.
question?
Go,
Thank
jump
you.
in.
Dr. Bagra, when we're talking numbers of beds, compared to 3 years ago, has there been beds decertified, fewer beds now that because of fewer beds, they are fuller? Or are we still looking at the same number as pre-pandemic, let's call it 3 years ago?
Yeah, so we've actually been fortunate that we hired to the beds we have electronic ICU consultation available. We have a higher level of expertise, a lower likelihood of sending patients over to the Rochester ICU. As we found during some days, Rochester ICUs were at capacity as well. So our teams took great care of patients in the Austin setting and were able to serve not just Austin, Albert Lee, but some of the surrounding communities as well. I have 2 or 3 episodes of patients that were transferred from more than 50 miles away because they could not find a bed in the Twin Cities area, South Metro area, where the ambulance brought them down to Austin, and those patients thankfully recovered, spent about a week or so, and made it back home to where they came from. So not only have we served local communities, we've also been the pop-off valve for some of the cases that have been looking for beds all across the state.
Fantastic. All right.
Thank
If
you.
anyone else has questions, just jump in too. I was wondering, I heard Mayo is looking at possibly terminating staff who don't get the COVID vaccine. Is that possibly going to make the shortage worse? Are you guys concerned about that, or is that not too much of a concern?
So, Mayo is a big family, and we would not like to see any family member go. The vaccination mandate is, of course, a CMS mandate on hospitals. All healthcare facilities are subject to that. In addition, the OSHA has mandate over hospitals as well that have more than 100 employees. So it's really something that we were asked to do that we have to implement both in spirit and the letter of the mandate. We do have a process for religious exemptions as well as medical exemptions. And the applications for exemptions are being looked at. There is a small number of employees who is currently not vaccinated. I believe among the physicians, that number is 95+%. Of the small number, many people are weighing their options right now. and we hope that most will choose to get vaccinated or apply for exemptions. At the end of the day, might there be some people who choose to leave Mayo Clinic or leave healthcare altogether? That's certainly a possibility, but we're working to mitigate that effect on our staff. The second part of the question about staffing shortages, I'm very happy to report that we've hired 25, 30 plus physician providers over the past 6 to 8 months. And recruiting should be hard during a pandemic because we can't fly people, we can't, shake their hand, we cannot take them out for a lunch to get to know them. And despite that, our recruitment staff have found more than 24 people to serve the Alberta Austin communities. So from a staffing perspective, direct provider, MD, APP, nursing staffing perspective, I think we'll be in a good shape. But I'd like to make the point that we didn't make this decision lightly. We are simply following through on the orders that were given to us. And we surely do hope that no employees currently feel like they have to leave because we have all the right information for them. Vaccination works. It prevents severe disease. It certainly prevents or diminishes the risk of dying from COVID-19 greatly. When our patients walk into a Mayo facility or any healthcare facility, they expect that the person providing care to them will not be infected with COVID-19 because, when people walk in for care, they want to be cared for and not potentially get an infection for the healthcare provider. And because vaccination makes people less likely to be infected, I personally believe and Mayo believes that that's the right thing to do. So that's a long answer for something that's obviously causing a lot of turmoil, both mentally, and we as the Mayo family strongly believe and hope that not many people, ideally nobody, should have to leave their employment because of the vaccine.
Okay. No, thank you. I appreciate it. One last question related to the hospital beds. Back when, I've wondered this a long time, back when Governor Walz first shut us down March of last year, he had stated the reason was to give us time to build out our hospital bed capacity. And I was just curious, did that happen? If we see a humongous surge in the future, are there like emergency plans in place, or do we have what we have and we'd have to work with that?
Would you repeat the question, please? I missed the first half around the Governor Walz piece.
Back when our governor shut us down for the first time in March of last year, he had stated the reason was to give us time to build out our hospital bed capacity. And I'm just wondering if that happened.
So a lot has changed since then. When Mayo also shut down some of the outpatient clinics on March 16th for a couple of days, that was really the initial recoil. We didn't know what to expect, didn't know what to do. There was no playbook for what to do in a COVID-19 pandemic type situation. Since that time, we've had 60+%, 70+% people vaccinated. So we don't expect a large number of people who are so sick that they require ICU level care to show up at a time. We don't expect that we'll run out of available capacity because the number of people potentially getting sick enough is going to be smaller because we expect the vaccinated cohort to not contribute so much to severely ill patients. Secondly, we do have a couple of different exciting oral tablets now available or in the pipeline that could potentially be taken by people infected to reduce the risk of ending up in the hospital. So outpatient therapy is available. And thirdly, there's outpatient infusion therapies available that bend the curve from the infected patients to prevent them from coming into the hospital. So if you look back at March 2020, this was a new virus. We had no vaccination available. Very little was known. We had no effective therapies. We now have more than half the people vaccinated. Of the other half unvaccinated, we do have at least 2 or 3 different ways in which to prevent them from being hospitalized. So if a surge were to come, say, in March 2022, it would look very different than March 2020. It was the initial fear of the unknown. And I think in hindsight, we didn't know what else we could have done better.
Okay, thank you. Here, I'll do one more. I'll skip a bunch of these questions, but I'll do one more and then a couple of vaccine ones. Do you know how many children locally have been hospitalized for COVID so far? Have we had many or?
So if I heard it correctly, have we had children hospitalized with COVID?
Locally, yes.
Locally. So we do not have pediatric hospitalists in Alberta and Austin. And anytime a small child would have COVID-19 sick enough, they would be sent over to Rochester. So my personal experience would be limited in that I haven't seen those patients locally because they don't get admitted to the local hospital in Alberta or Austin.
Okay, perfect.
It needs specialized care. You know, it's said in medicine, children are not little adults. Their bodies are different. Their physiology is different. They require different types of tubes, different type of machines. And really to achieve the best outcome for a child, they ought to be cared for by pediatric intensive care specialists who know how to address children. Their blood pressures are different, their breathing mechanics are different, so it's a totally different world. And typically small hospitals do not take care of critically ill children, and they do transfer them over to larger hospitals for the best possible outcomes.
Okay. I'll skip ahead to my vaccine questions, just 2 or 3. The main concern that I hear from people, and it's one that I have myself, is that there aren't long-term studies on these COVID vaccines. I'm just wondering, how long have they been studied, and how do we know what the long-term effects are? How do you answer that question?
Right. So I read something that really struck with me. I mean, that's a question that many young people have, or many childbearing age group women have. And we obviously have had the vaccine available now for, I forget, November. So about a year now that it's been approved. It was studied for probably 6 to 8 months prior to that. And in every analysis that we do, if we look at people infected, we've known about the virus now for about 2 years. If you look at people infected and look at their outcomes of heart inflammation or lung damage, every side effect from the vaccine occurs much less commonly compared to getting infected. So one way to look at that would be not that we have 10 years of data available, but that if you were to look at the unvaccinated cohort getting infected either unintentionally or intentionally, and look at those 10,000 people and see what types of side effects they end up with, such as long-term lung damage or long-term heart damage, or not being able to be employed, after long COVID occurs, and compare those two people so far over the past 1 to 2 years, you find that the people who have side effects in the vaccination group, they tend to be mild side effects that are self-limited and very little long-term side effects over the past 1.5 to 2 years.
Okay. Are those who are vaccinated being followed up on on a regular basis in a systematic way, or do you know, are we depending on self-reporting for adverse reactions?
I did not catch part of the question. Could you repeat that? I think it's the masking and the muffling and the
Here,
sounds.
I'll take my mask off for a second. No, thank you for that. I'm just wondering, are those who are vaccinated being followed up on in a systematic way, or are we relying on self-reporting for any problems that people are experiencing?
So if I got the question correctly, are the people who are vaccinated and get infected is the data being collected systematically versus being self-reported? Is that correct?
Well, I'm just wondering, because my understanding is, we're still studying these vaccines, so I'm wondering if people, as they get them, are they being followed up on in a systematic way, or are we relying on them to report if they have any problems?
So it is both. I mean, people do self-report symptoms as well, and if they show up in an emergency department or come back to the clinic, physicians and providers will report those to the vaccine side effect database as well. So when vaccines first got approved, as part of the approval process, patients were followed for several months, and any potential side effects, which were really looked at very carefully, were categorized, and even minor side effects had to be reported as part of the FDA submission. Following that, in the real world, once approval is given, it's a combination of post-vaccination surveillance, both by the drug manufacturers as well as the healthcare providers that see them, and filing reports back with the vaccine adverse effect, the VAERS database as well.
Okay, thank you. Last question, and I'll leave you alone. Do you have a guess, are we expecting that people will need to get booster shots after this round? Is this going to be a regular occurrence, or is this a one last shot and they should be good? Do we know?
So I would not venture a guess there because everything that I thought about COVID early on has been proven to be wrong, because I infamously thought in March 2020 that this is just a 6-month deal and that I was gonna travel overseas and see my family December of 2020. I haven't gone there back for the past 2.5 years. The booster does boost immune responses and the antibody levels go up. How long do they last? And it really depends on what the vaccinated cohort does in terms of safety behaviors. So if people who get vaccinated and boosted, buy the next ticket to a large concert or start seeing sporting venues and end up mass exposing each other, it's possible that we'll see a lot of infections in the boosted individuals, which would then bring to light or forefront the need for additional vaccination as well. So what I know so far is that the booster is effective in boosting immunity. Does it last 9 months, 12 months, 18 months, 5 years? I don't know. With the caveat that I'm not a vaccine or infectious disease expert, and there's probably research going on that I'm not familiar with. What we have so far is the emergency authorization for the booster. It is conceivable that there might be other series down the road as well, perhaps less frequent, perhaps a different type of booster, but all those are speculative at this point in time.
Okay. Thank you. That's all I have. I really appreciate it.
Jill.
Thank you, and thank you for being with us tonight, Dr. Bagra. I have 3 questions, shouldn't take too long. I've heard anecdotally that locally of our positive COVID tests that about half have been vaccinated and half have not been. Do you have any idea what that percentage would be?
So that number seems high. What I've heard is that, so assuming, somebody asked me to run the math, assuming 80% of people are vaccinated and 20% are not vaccinated, say in a larger urban setting, Freeborn County and Minnesota are not in that 80-20 cohort. It's almost as if 20% of all infected cases come from the vaccinated group and 80% of all infected cases come from the other group. So the unvaccinated group contributes 3 to 4-fold higher number of cases, which goes with a 5 to 10-fold higher risk of severe infection and dying in the unvaccinated group. So one way to look at that is if 90% of people got vaccinated, you would obviously have a larger number of people infected who've been vaccinated. If you had 99% people vaccinated, you might have 5 people unvaccinated who end up in the hospital and 5 people vaccinated who end up in the hospital. It's important to look at the denominator they're coming from. Right now, assuming 80-20 split, the number of vaccinated people contributing positive cases is much smaller than the unvaccinated people. So the absolute numbers among the unvaccinated are definitely higher than the vaccinated, even though the vaccinated people outnumber unvaccinated 4 to 1. So the relative risk of being hospitalized is about 5 to 10 times higher among the unvaccinated. But seeing the vaccinated infected and being in the hospital doesn't surprise me because the vaccine is not 100% effective. And it is possible for somebody who's vaccinated and even immune to engage in behaviors that breaks through their defense mechanisms. So if you had 1 million particles, say, show up, or you ended up in a bar where 5 people were positive and you ended up, unfortunately, sitting right next to them, it is possible that after 30 minutes of sitting in that area where people are talkative, not wearing masks, that a vaccinated person could get infected as well.
Thank you. And then how would you answer the logic question of, so it seems that the symptoms are brought down and severe illness and deaths are brought down with vaccination. But as far as transmission, if one's symptoms are less and like you said, they do participate in, could participate in more risky behaviors, as do other portions of the population as well. How do you see the impact as far as the transmission piece?
Right, so the viral load, again, caveat being I'm not the expert that has all the studies at my fingertips, The general perception is that the vaccinated individuals get infected less often. They get severe disease less often. They perhaps carry a smaller viral load inside their body, and their duration of infectivity could potentially be lower as well. So if a non-vaccinated person sheds the virus for X number of days, the vaccinated person could shed it for a lower period of time. So the reason they get asymptomatic disease is because the virus is not present in those large numbers inside their body. So it could just be a transient infection that maybe lasts a day or 2 or 3, and then they're no longer infective to other people, thereby reducing the spread in the community if we had predominantly a large percentage of population vaccinated here.
Thank you. And my last question, I know for a time, or I had heard for a time, that if an individual died and they had several coexisting conditions, COVID happened to be one, that the cause of death would be listed as COVID. Is that still in effect?
So if they came in with COVID and lung failure, heart attack because of COVID, etc., then COVID really contributed to that death. Yeah, it's just a hard one because, COVID sets into motion pathways inside the body that decompensate some of the other organs that are failing. And I cannot, to call it not COVID would be not the right thing to do, because COVID infection really set in motion the things that led to a person's demise. Because before COVID, they were just compensated, doing well despite having all the diseases such as diabetes or heart failure. So if you throw a pebble in the pond and the ripples occur, is it the water doing it or is it the pebble? I would call the most proximate trigger as the cause of the person's death, even though when that process sets in place, it sometimes becomes irreversible and the organs do fail or the kidneys do fail. As a physician, I would still call COVID the reason that they ended up in that situation. I know there's a lot of misconception, misperception out there. Some people claiming that the hospitals were being paid more for, calling something COVID. And I think, I don't know how those perceptions arise. I'm sure there's some basis to that, but from a medical perspective, we don't see it, we don't do it, and it's sometimes frustrating for the medical community to hear all this, but it's good to have a dialogue so that, everybody could be on the same page and try to understand each other.
Thank you.
Any other questions? Dr. Bagra, thank you very much. Very informative, and your expertise in the area is well appreciated. Thank you, and good luck with your battle.
Thank you so much for having us, and we'd be happy to send the slides as a PDF if needed for inclusion in, minutes, etc. None of the data we presented is, confidential, etc. So
thank you. That'd be great.
We'd be happy to send that along.
That'd be great. Thank you very much.
Thank you.
Okay, let's go to 9.1 then, Kathy. You'll have a district COVID update.
So I'm just going to share with you the slides that I share weekly with the school board with a few updates. And so starting with the update, as you all know, ages 5 through 11, we are offering, hosting on-site voluntary COVID-19 vaccination clinics. They are being staffed by Freeborn County Public Health. We will provide some translators and adults to help shepherd those families. And they are offered after school from 3:15 until 6. November 18th is at Hawthorne and Halverson, November 22nd at Lakeview and Sibley, and as Dr. Bagra indicated, they also will be able to sign up for their second dose and be fully vaccinated prior to the winter break. We have about 3,500 rapid testing tests from the Minnesota Department of Health. They are the Binax Now at-home testing for students only. They are not available for staff. We're not authorized to use them for staff. As I said, they're voluntary. We are looking at the Rochester Public Schools program to potentially roll this out after Thanksgiving. We have to work with some HIPAA rules on this, as we will be sending these tests home. What Rochester is doing is sending the tests home with the students if they're exposed at school. So have their masks off at lunch, they're sitting together 20 minutes. They then are identified, say 1 to 5, 7 days later, et cetera, as a close contact. What Rochester is doing is the students get sent home when they're identified. Parents agree to participate at home with this testing. It's voluntary. They don't have to. They can choose to leave their student at the out-of-school quarantine. They're out 1 day. They test at home. They would upload a test result to this HIPAA-compliant website. Our health clerks or school nurses would then take a look at that. If it was negative, the student could come back on, they'd be out 1 day, could come back out on day 2. And then they would continue to test at home, and as long as it was negative and they weren't symptomatic, they could continue to be back in school. So it is an option that other districts are using, and I believe Northfield, it's either Northfield or Faribault, one of the districts to the north of us, are rolling it out shortly as well. Lastly, if you haven't heard, that OSHA has issued the emergency temporary standard for mandatory vaccinations for employers with over 100 employees. So for employees who are receiving a W-2. So that has, it's in appeal right now in the Fifth Circuit. We did find out Saturday morning that it looks like it's probably headed to another court. We do not have policies or procedures to bring forward to the board tonight. Right now, the date is set for December 6th as the deadline for organizations to have procedures in place. And so we are waiting for either the Minnesota School Board Association or some of our legal counsel across the state to help school districts with what those policies and procedures are. Several of us have attended multiple webinars in the last few days to kind of walk through what that looks like. Should it be put into place, it would be implemented on January 4th. That's all we know at this point. Basically, Minnesota looks like it's either mandatory vaccination or weekly testing. And so it is pending right now on appeal, and so we wait. That's about all the information I have for you. I do have some more detail on it, but you know, it's hard to say what would happen in the appeals process and how things will change. So just FYI, that's where that is. This is this morning, our Freeborn County numbers that are gathered through the Wolfson website out of the University of Minnesota. I did have a couple of inquiries about that number 150 that the board has passed in their resolution as unmasking students, and when, you know, have we ever been there? And this is back to July 1, and so you'll see in July, when we talked about this to begin with, we were well below 150. So we have been there before, and of course we hope that we return. So this I've showed you a couple of times. These are the state from the Minnesota Department of Health, and this is from last Wednesday's school nurse and COVID coordinator call. Blue is last year in schools, and orange is this year in schools. And the lag was, last time I reported, about 2 weeks behind, and on the nurses call last week, they are looking at about being 3 weeks behind as infections increase across the state. So that's just a comparison, orange this year, blue last year. These are our current active cases since the beginning of August. And you can see we've had some dips. And yes, the weekend numbers show up there as 3. So you'll see a gap between Friday and Tuesday, and that would be 3 dates. And I can't really disaggregate that because the county doesn't provide us disaggregated data on any of these. But these are our active cases. And today, we did have 10 new cases come in today. These are the straight numbers, straight from the Freeborn County Public Health information, the number of new cases that come in, and that's total. The current number of active cases in the county, and then disaggregated just by our school age, 0 to age 19. And then graphing that, it looks like this with our numbers at the bottom of school age students. Again, this is the same data I send to the board. I try to update it every week, and you get the most updated usually on Fridays. And then the next slide. So the county data is a little off, and we've talked about this a couple of times. We can gather data Sunday through Saturday, but the county really publishes data Friday through Thursday. So red is all of school-aged children active positive cases. Blue are our positive cases. We know those to be true. And then the difference simply is students who are not enrolled in Albert Lea area schools. One of the things that's happening now is that if a parent or a guardian provides the school with a positive test result from a Binax Now at home, and it's positive, we consider that a positive. That will not appear in the Freeborn County numbers because it's not lab confirmed. So we're going to start to see some disparities as we look at that. The Minnesota Department of Health considers a positive, but we have had some parents then go back and do a PCR test, and it may come back negative, and we accept that as well. But that is going to be probably, our numbers will look goofy moving forward because Freeborn County won't have those numbers. And this is the second column, the number of cases we'd have to have in any of our individual schools to hit that 5% threshold to move to a different learning model off-site. And we've not hit that at all. We haven't really come close to that at all. And again, I provide these to you every Friday, if not weekly, if you check the slide. And then this is new. We've been talking about staffing. And so we have a couple of new secretarial staff in our district, and so it's been kind of hard to get them to, because they're so busy, kind of gather all of the number of times that, sorry, I lost my, what I was saying there. So what this is the hourly openings for the last month filled by internal subs. And so Mr. Dibble and Mr. Elfson here talking about, what is it looking like in the classrooms? And so blue is the number of hourly subs filled internally. So as you can see, we're as high as 45 different times a teacher is giving up their prep and or their supervision or both to fill in. And that is an increased stressor on our staff. And if you see how high they go, and then so what the orange bar is all of those in blue are needed to fill the capacity of the individuals in the orange bar. So when one person is gone, they might be 5 hours of subs we have to get, or it might be 7 hours of subs we have to get, or it might be 2 hours because they're maybe a work program coordinator and we don't get subs for certain hours. Or so I just think this is something we've talked with the teachers union about multiple times. We've talked with principals about it. We talk with our paraeducators. Teacher subs are difficult to get. Paraeducator subs are difficult to get. We do our permanent on-site subs in our most probably needy classrooms as we can. But it's a challenge, and in a couple of weeks I'll be bringing forth some information on what our sub pay rates look like. I know we've looked at that over the years, and so I'll be bringing that compared to the Big Nine, and then also compared to maybe another district in the county. So that is new data. That's our fill rate in a different way that I asked payroll to pull for us. So any questions?
No? Thank you, Kathy. Thank you. Okay, nothing under 10, so we'll get into 11, effective and efficient operations, and we've got our tax abatement discussion. Jennifer.
Yes, I'm really just going to turn this over. Megan Boak, the city planner from the city of Albert Lea, is going to address the board about a discussion of a tax abatement that they are considering. So, Megan?
Well, thank you. I'm Megan Boak, the city planner for the city of Albert Lea, in case you don't know. And I work on most of the community and economic development projects that you see or hear about on behalf of the city of Albert Lea. Tonight I'm here to discuss a redevelopment project at 131-137 East Clark, which is locally known as the VFW. It's also listed on the National Register of Historic Places and sits within our commercial downtown. In part of our work to eliminate Albert Lea's housing shortages, about 2 years ago, we started conversations with a developer looking to invest about $2.6 to $3 million into a 20 or 22 unit market rate apartment complex. To date, those developers have received all of their state and city approvals in regards to the historic components. Due to the increased costs in rehabbing historic structures or meeting historical standards, especially one in a dilapidated state such as the VFW, in addition to our lower property values and our lower rent margins, the developers did request a subsidy or tax or incentive of tax abatement for a 10-year period from the city, county, and school. Outlined in the memo that I forwarded earlier, the abatement amount is driven by the increment of new taxes generated by the redevelopment. It does not include abatement of taxes on the existing value. So to simplify that, I would say if this abatement were approved, the owners would continue to pay taxes on the building as valued today. And once the abatement term expires, or once 10 years expires, the developers would pay taxes based on the full value as determined by the county assessor. To break this down specific to the Albert Lea School District, if the abatement were approved and when the project is completed, the school district would be abating about $1,729 or $1,729 every 6 months, or just over $3,400 per year. I just want to add that with this particular development, tax abatement is the only incentive or subsidy allowed by the state of Minnesota for a project of this kind. So earlier when you've talked about workforce shortages or childcare issues, housing, I would add housing to that list specifically here in Albert Lea. It's just that, tax abatement is the only option we have for incentivizing, especially market rate. Lastly, I would just point out that, the next step would be to advertise and hold a public hearing. Tentatively, that could be December 20th. And then once the public has a chance to make comments, we could draft a 4-party abatement agreement, which would include the city, county, school, and the developer. We would forward that here for final approval, either acceptance or deniance. That would probably most likely be set for sometime in January. And with that, I'd be happy to answer any questions, or you could certainly, in the interest of time, if you wanted to forward your questions to your staff, I'd be happy to answer them later too.
Kim, do you have a question?
Yeah, I just have actually just that you mentioned that this is market rate housing, right?
Correct.
So can you just share the difference between subsidized and market rate? Because I think some people aren't aware of what the difference is.
So market rate is a rent charged by the property owner, in line with what they think the market could bear. So some of these units I've seen in the pro forma that they sent for us to determine this tax abatement, anywhere from $660 a month to $900, maybe even a little higher. And a big reason why tax abatement is our only option for, subsidy or incentive is because they aren't low to moderate or affordable. The state allows us to incentivize low to moderate or affordable through other means, but market rate tax abatement's our only option.
Any other questions, or as Megan said, we could forward them to our staff and on? Okay. Thank you, Megan.
Thank you.
Okay, 11.2. We have some policies for review. Jennifer, I think policy 533 is 11.2.1.
So this is the third and final reading for the policy 533 wellness. And I think we've gone over this a couple of times, but are there any other questions?
All right, seeing none, I would look for a motion to pass the changes.
I'll make that motion.
Second.
In a second. Okay, any other discussion? Seeing none, all those in favor signify by saying aye. Aye. And oppose the same sign. Okay, motion passes. 11.2.2 policy 10230. And that is Sheila. Thank you.
Yes, thank you. Student medication policy 516, the revisions. Any questions from anybody on our revisions to the medication policy?
Kim,
I'll move to approve.
is there a second on that motion? Neil will second it. Any other discussion? Angie?
Just a comment, I've gone back and forth about the EpiPen issue, and I think I am going to vote against it because I am more comfortable having the backup EpiPens. I do understand the arguments for the changes, but I just wanted to explain where I'm at with that, so thank you.
Okay. All those in favor of passing the motion signify by saying aye.
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 And oppose the same? Okay. Okay, passes. Thank you, Sheila, 6-1. 11.3, Health Partners Well at Work Contract Amendment. Jennifer.
Well, I'm very excited about this. This is something that I've alerted, I think back in September, I kind of gave a little talk to you at a meeting that this is something we've been working with Freeborn County with partnering for our Well at Work clinic. The people at Freeborn County and our representative with the National Insurance Services, Aaron Casper, have really, we've spent a lot of time bringing this to fruition. The actual document is actually somewhat simple. It is an amendment to our current service agreement with Health Partners, and it does two things. The biggest and the one that will impact us the most is it will reduce the school district share of the cost of running the clinic. So you can see in the exhibit 2.1, if you could just scroll down a little bit, Ashley. This is the practitioner fee and the management fee is what we had agreed to for our July 1 renewal. And that will be reduced by about 38%. So our school district will be responsible moving forward for 61% of those fees, and Freeborn County will be picking up the other percent. And those percentages were arrived at, we looked at the total number of insured bodies in each of the two groups. And so the split was about 2/3, 1/3. The other amendment, in our original agreement, we would do a annual reconciliation. So we have this dollar amount that we've agreed to pay, and that is mitigated by claims that are paid by our insurance company. So that reduces what we pay. Generally, we do that reconciliation once a year. We needed to make a little bit of an amendment. We want to do that reconciliation now at the end of December so that we are starting with a clean slate as we enter into the cooperative agreement with Freeborn County.
Okay, any questions? Go ahead, Dennis.
Is this agreement just through end of June then, and then we look at renewal?
So, yeah, so we'll every June we get a renewal rate from Health Partners. And so that new rate then for July, starting July 1, 2022, will be reflective of the cost being split between us and Freeborn County.
And then Freeborn County will have to be renewed again?
Yeah, and so now they're getting a brand-new agreement with Health Partners, and their agreement indicates their share, or 38% of the total. And so, yes, every July, we both will have renewal agreements.
And based on actual numbers of each entity.
Yeah, and so then we'll relook at what's the split between the two entities.
Yeah.
Is it possible for some other entity than Health Partners to submit bids for?
Yes, so we are going to be conducting a RFP, or request for proposal. That will come out. We're working toward getting that put together in January. It's a process where we need to identify what are all the things we want our clinic to do. And then we will put together that request for proposal, and then other entities will have the ability to bid on running our clinic at the site. So it could be potentially not Health Partners moving forward.
Any other questions? All right. Seeing none, I look for a motion to accept the agreement.
So moved.
Bruce, is there a second? Angie, second. All right. Any other questions? Seeing none, all those in favor signify by saying aye.
Aye.
Aye. And oppose the same.
Thank you. We are planning to have a open house for Freeborn County. Their Board of Commissioners will vote on this tomorrow. And so here in the next couple of weeks, we're going to have an open house and welcome that group into our clinic. It's going to be a win-win. Thank you very much.
Thank you. All right. 11.4 was added on, so I will let Angie introduce me, because she's probably had more time to think, and go ahead.
All right, well, I don't really have anything prepared other than I don't know if we're going to still continue having these types of situations at the beginning of our meetings. Hopefully not, but if it does happen, I just think it would be good for the board to have some input on how we want to handle it, not put all the burden onto Dave, and just see, do we truly want to, obviously we approved to implement a mask mandate, but I'm just wondering, do we truly want to push it to the point of getting police involved and giving people, footage for their cameras that they're going to share and things like that. So just wanted people to be able to talk about that and share their thoughts.
Neil.
Yes. Once again, I see two issues here. How are we going to conduct our meetings, and then the issue of mask mandates. And granted, it's the mask mandate issue that precipitated the need for discussion on how we're going to handle the opening of our meetings. And I think my opinion on this is that there's an established arrangement for how public meetings are conducted, and it's not that complicated. The public is invited, or is 100% guaranteed to be able to witness public meetings. But that doesn't mean that the public has an opportunity to, in their seats, to address whatever level of elected officials we're dealing with, the city council, school boards, county commissioners. There is a protocol for the public speaking at a forum, which is clearly outlined and identified, but for people to volunteer comments, address comments to the board or to the county commissioners or to the city council from their seats is out of order. It's entirely inappropriate, and we shouldn't tolerate it. Now, the question is, how do you deal with it? I mean, it's like conducting a class with unruly students that won't abide by, classroom procedures. It's a difficult thing, and I would hope that since the people generally who are attending our meetings are responsible adults, they wouldn't put us in a position to have to come up with some enforcement procedure to deal with inappropriate behavior. The onus is on those in attendance to conduct themselves in a civil manner and not become an obstacle to the conducting of the meeting. Now, again, that doesn't answer your question. I don't know. How do you deal with inappropriate behavior?
What's the current plan, Dave? Is it kind of what we've seen so far?
It's just to make sure everybody's aware of the mandate and follow the mandate. I mean, it's not a popular thing with me wearing a mask or anything else either, but I know when I walk in the buildings I have to. And so that's all. I mean, we don't need to start the meeting until that is accomplished. Otherwise, it may be overseen if someone doesn't have a mask on. You know, so I want to make sure that we start the meeting that way, that everyone's in compliance with the mandate. Oh, yeah, Joe, go ahead.
You know, in talking about things being out of order and being responsible adults and acting in a civil manner, I think number one, as a board, we need to model that, and we have not. That's not the discussion for tonight, apparently. But when we are talking about starting our meetings with everyone in the room being masked or forced out of the room, or apparently, I don't know what happened tonight, arrested or trespassed, I don't know what happened tonight. It's a sad situation because of the inconsistencies in the district. Now, we have had the mask mandate in place before the board voted on September 20th, because long before that, the board gave administration the power to put that in place. Was it enforced? No, it was not in the board meetings. Neither, apparently, and by my own witness and from other testimony I've received, it has not been enforced in every classroom. It has not been enforced at every athletic meeting. It has not even been enforced in the boardroom. Even last meeting, and I have to say this, I do not believe for a minute that those two people were missed last meeting. I believe they were seen and not addressed. So all of these inconsistencies are what bother me, and I believe put the district at liability. We either, and to, you know, what it comes down to is this. If this is the case, this is not about student safety. This is about manipulation and control. That's what tonight felt like to me. Manipulation and control. This was not about student safety, because then this would be happening at all the other venues, and it is not.
Any?
So I'll comment. What I saw tonight was people that were here to be honored felt that they needed to leave because they didn't feel safe or were following protocols that we set in place, and they had to leave. So I have a different opinion than that, Joe. The other thing is, I'm not sure when you say the board needs to model that. I think all of us need to model that. And I'm not quite sure when you say that if you're talking about all of us or not. So I'm concerned about that. Plus, all of us sitting at the table last month could have called out and said, I don't think we've appointed one person to say they're not wearing a mask, and nobody did. So I absolutely don't like the inconsistencies, sure. But how do you fix that if you don't address it now when it's been identified? How do you fix that? You follow your mandate, and you model for students. I mean, my biggest concern is what are we showing our students on how to collectively and appropriately and respectfully address each other. When we say we call people, we don't necessarily call people, but procedures wrong, or we call things that have happened wrong. I think we have to be super careful about that. And I am willing, and I have said this from the start, I'm willing to have those tough conversations if we need to about board protocols and board ethics. I want to have that for all of us so we can be transparent. But we all have to be on that same page. And I feel like lately, this group has not been. And we got to come up with something. It's on us to do that. It's not anybody else's responsibility, it's ours.
And to answer your questions to me, I do mean all of us. And as a group, we have not modeled this, and as individuals, in the boardroom and out of the public eye. So I include all of us seated at that table when I say these things. And I will, if I believe that something has been handled in a way that is inappropriate, that opens the district for liability, that is not in the best public interest or the interest of safety, I will call it out. I will address it. So hopefully those will answer your concerns.
Bruce?
You know, we welcome the public here. And while we have this mask mandate, it's simple for me. Put on the mask so we could put the meeting on and you can enjoy the meeting. It's just simple. Wear a mask.
Yep, Dennis.
Sorry, go ahead.
Yep, go.
We've put ourselves in a tough situation because we have the mask mandate. Unfortunately, we need to follow that while it's in place. But having said that, the individuals, when they come in, we need to hear what they have to say, what they want to say. I know they don't like it. If they could wear the mask here, tell us what they want, what they're needing. I think we have to listen to everything, and we'll continue to work and follow through it. This is what we have in place right now, so we're asking everybody to follow it and do. At the schools, our staff, our teachers, our kids, we're asking them. We have to have some ability of trust and accountability, and when things aren't going right, they're doing the wrong thing, we have to let them know. But until the time when we change that rule again, I think it's important to keep that integrity. I want to see those individuals sign up to talk. Give us the 2 minutes, let us know. That's why we changed the length of the time for the open forum. We need to hear what everybody's saying. But if we can do it in a respectful, uplifting way, understanding that this is the situation we're in right now, and hopefully our numbers come down so this issue goes away for all of us. None of us are perfect. We all make mistakes, and we need to do what's in the best interest of the children, and we're pulling ourselves away from that right now. We really need to get back on track, and that's all of us, not just the public, not just the board. It's all of us together making a difference.
And will you apologize for the way you acted at the meeting?
Okay, Jill, did you have another?
Oh, thanks. Yeah, I was just, now that we've had law enforcement intervention here in the boardroom, are we going to be affording that to our students in the classroom and at other events as well? To me, it feels very hypocritical to show one series of actions that happen here in the boardroom that are supposed to affect the entire district's procedures. That's not how it's been happening. That's not how I mean, are we implementing that tonight? Are we implementing law enforcement engagement in every building in this district, and we're going to do what happened tonight to every offender in every building? Are we?
You know, I believe we can only probably deal with what we're dealing with at the time. Will it happen at every event and every building? I'm not sure. I mean, should it consistently? Yes. I don't think we probably have enough law enforcement to do that. We would hope that everyone, for each other's safety, might consider to be a little bit self-patrolling on that too. But I hear what you're saying, Jill. It would be very difficult task. I think it's because it happened tonight here in the boardroom and wished it wouldn't have, but it did. And hopefully that changes, becomes better, if you want to call it that, down the road.
So,
Kim?
Chris, how much of this is an issue at the high school, one of the buildings?
We've had a small handful of people refusing to wear the mask, and they're asked to go home.
And you haven't had to have Officer Khan come in, or?
We haven't had to issue any disorderly conducts or trespass anyone for masking.
And is that the same situation for athletic events that have been held at the high school?
I would imagine they're trying to be patrolled the same way.
Right. We make announcements as we can. I mean, I only saw, Jill, I think I don't know which one you're talking about exactly. I've been at more football than volleyball, but I know volleyball had some issues in it. Is that what you're referring to?
I think there are some public images that illustrate my point.
Okay. I know I went to a volleyball once, asked, Tom Jones was running the mic, asked for them to mask at that point, and we had a conversation with the students using the 5-minute pause. That's the new growl the next day. So as we do on a daily basis, we do the best to educate the students on what their expectations are.
And then it comes down to the enforcement piece, though. That's where the difference lies. The enforcement is not equal across the board. The enforcement is not the same outside of this boardroom. Somehow in this boardroom, then law enforcement needs to take action, but that doesn't happen other places, and so therein lies the problem for me.
Go ahead, Neil.
I think the explanation for that is quite simple. I would assume that in high school, as students were asked to leave, they left. And it wasn't necessary to impose law enforcement on that situation. Again, it comes down to discipline. If someone is inappropriate in their behavior and their non-compliance, then what other recourse do we have? And again, the onus is on the offender. And it's as a teacher, I found it very frustrating when students would, by design, put me in a position where I had to drastically impose some kind of consequence. I'm very uncomfortable with drastically imposing any kind of a consequence. And I'm very frustrated when I'm put in that position. I don't want to be in that position. And it's not my fault that I'm in that position, and yet I have to deal with it. And that's my response to what happened tonight.
Angie?
Yes, I guess a difference that comes to mind is, between how we handle it here and with the students is these, for the most part, are adults out there. They're not kids, they're not children. They're the people who have put us here, who we're working for. And I respect that we have a mask mandate in place, but I think when we push it so far to the point of getting the police involved, I think, from my perspective, it makes it worse. It hurts the relationship with the public, and it's just making it worse for us. So there's my 2 cents.
So what do we do when people in the audience refuse to comply to wearing a mask? What do we do? Sit there and do nothing? Again, I don't want to be in that position, but we get put in that position. What are we going to do?
Well, I mean, from the way a lot of businesses have handled it is you just assume that they do have a reason that would exempt them, and you can just give them a little bit of leeway. And we might not want to do that, and that's fine. That's just my thought.
And yet, then why were we put under the gun? Because at the previous meeting, there were some people without a mask, and we didn't notice it. That result obviously doesn't have good results.
If it comes down to this, and again, I don't believe it wasn't unnoticed. So why don't we just move to a larger area? Why don't we move to the gym? We can't really be outside anymore. Why don't we move to a larger area where people can at least distance and do the things that Dr. Bagra said tonight, hand washing, distancing, you know, I mean, it was mentioned, people have to self-police, but we're gonna not self-police, we're gonna law enforcement police when it comes to board meetings. Otherwise, everybody's gonna self-police. Why don't we just move to a larger area and allow more space for individuals?
Go ahead, Neil.
Well, correct me if I'm wrong, but as I understand it, the mandate to wear a mask is not a function of how far you are away from somebody in the building. If you're in the building, the only reason you cannot be wearing a mask is if you're eating. So maybe we should adjourn to the cafeteria and have lunch when we have our meetings, then we could all be without masks.
Actually, I think the function is that you have to be in the boardroom. Otherwise, I don't think it matters as much. I think the function is that you have to be in the boardroom. Otherwise, law enforcement is involved.
Jill, I think any building on the school grounds or any place in the school ground, any building in the school grounds that's where the mandate is, I don't think where it would matter where we are at. You would still need to wear the mask as long as the mandate's in place.
My point is the school board in session. Otherwise, that's the deciding factor. It's like any place else that's not concerning us and apparently our oversight to whatever, you know, then it's not the same. Otherwise, it's just community policing, except when we're involved. That's what I meant by that, not the room, us.
Kathy and Chris, these are isolated incidents potentially that are out there in the public of unmasked situations, because I feel like we're kind of hanging our hat on some public type nuances, maybe. Could we address that?
Well, I'm rarely in the buildings. I am mostly in my office. But I do walk around this building, and I do occasionally see people who are unmasked. And because of my job and who I am, I typically don't have to say anything, and they pull their mask up. However, there are times where I see adults who are done eating lunch, and they're milling, and not 6 feet apart. And I don't know how long for their 15 minutes. And I do tell them, you need to mask up. Well, we're just finishing lunch. Yep, you need to mask up. We have people who, you know, Mondays are, you know, they come off the weekend and they're at home and they're not masking. And, you know, they'll be walking down the hallway and they don't have a mask on. And, you know, I just, hey, oh, you know, I forgot. It's, you know, my first day back, or, you know, it was a long weekend. You know, I do think we give some leeway there. And I will say, I walked into this board meeting last month and last time, and I did not see the individual, and I walked right by him. And so and this is what I do all day. I see masks. So whether people were seen or not, I don't know. But I talk to staff. I don't talk to students. I think I can defer to maybe Chris and...
Yeah, Corey can probably jump here with me too. What I've turned into is hats and masks, even when I'm not doing my job, and it's embarrassing sometimes where you're walking through the mall and you're like, hey, oh man, it's not my time for that now. But it has become so habit forming for us in the buildings just to walk, you know, if there's a kid that has it down, you just pull on it, or if they got their hat on, you tap it off. We do this all the time. And so to say that we're not policing it appropriately, I would say isn't fair for what we do, because we're doing our best to get this mandate or this procedure in place. And I don't know, our numbers are lower than our surrounding schools. So until you tell me to do otherwise, I'm going to stick with it and keep our kids safe. Corey, as a teacher, I know it's one of you'd like to teach more than mandate masks, but it's part of what we do.
It is just part of what we do. And the hallways are filled with students and staff when the bell rings. And if you see somebody trucking down the hallway without a mask, they get a reminder. They get several reminders because there are many staff in the hallway. Is it 100% all the time? Do you catch everything? No. We're doing a pretty good job of following along with the mask mandate.
And again, to follow up what I mentioned earlier, in my experience subbing a week ago last Friday, I didn't see a whole lot of belligerence. I didn't see any belligerence on the part of students. They needed a reminder, and it was kind of a game they play, as they often do. But it wasn't a problem. It is a problem because COVID's a problem, but it wasn't. I was reassured, at least with the small sampling of students that I had. I was reassured with the attitudes that I encountered. But one other comment. I hate to be an annoyance, but I assume we have a motion on the table.
No.
This discussion is interesting enough. We
Discussion.
don't?
Oh, you had discussion.
I thought
asked for
Angie made a
discussion.
motion. Oh.
Was that, Kim? It was just discussion. Discussion is
Well,
what we
that's
wanted to
good,
make sure
because
we
I
had.
would have no idea what we're
All right.
voting on.
All right.
And I wanted to clarify a couple of my comments too. When I have mentioned these examples, I'm not talking about students. I believe the students are being policed. We're overworking that word tonight, but I'm not saying that staff is not policing students. When I'm talking about these situations, it is the adults that I'm concerned with.
Okay. All right. Good discussion. Thank you.
You know, I don't like.
Oh, sorry, Bruce.
I
Yeah.
don't like what happened tonight either, but have we come to a consensus that it's gonna continue the way it did tonight, or how are we gonna address the situation if it
I
comes
don't-
up again? Just require that all masks be worn by people present?
Yeah, I mean, that's, still the mandate was here. Yes. Okay. All right, thank you. I think we had one other, Jill, we had replaced 7.5 to 11.5, and Kathy was going to come up on that too. And you had some thoughts. Go ahead.
The point of my concern was, and I don't know where it is right there, but it has to do with a vaccine mandate for part of it. Something about.
Correct, so that's under subdivision 3-4. So this is the disability reserve MOU that the union has brought forward to the school board for probably 4, 5, 6 years now, that allows a teacher who is in this bargaining unit to donate a set amount of days that the union has decided to donate to this disability reserve. And should they have a serious illness that is a FMLA qualifying event, and they've exhausted all of their leave, the union, they can then make application to the union to access the union disability leave bank. So this is their bank. They operate it. They collect the days. They communicate to their members. They then have their members send it to payroll that they've donated whatever the minimum amount of days are by the date described in the MOU. And so those days sit in this bank. And then an individual gets seriously ill. They've exhausted all their leave. They apply to the union for use of that disability leave. This is all that's allowed really under law now. We used to be able to donate PTO and things like that, but that then is a taxable item. And so this is the way colleagues can help their colleagues when somebody is ill. Last year, you as a board, we worked with the union to amend the language of the MOU for 1 year, which is what we're trying to do this year as well, so that someone who has exhausted all their leave can go to the union and say, I've used up all my leave, I'm very sick, I have cancer, I'm going to be out, can I access the disability bank? The union has gone to Ed Minnesota, to their legal, and said, we want to add COVID for 1 year to this bank. In order to do that, it has to be a COVID-related illness for the employee. So it can't be, I'm going to have to quarantine with my child for 10 days, and I only have 8 days of leave. They can't go to the bank for that because they have to be ill. So the union has decided to add this language, which you referenced. It is, the teacher must provide documentation establishing that the immediate family member has such a condition. If the 30 days, blah, 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 are used, they may apply for an additional 30 days. For the 21-22 school year only, the Disability Leave Reserve Bank may be used for COVID illness. Proof of vaccination, subject to required medical or religious exemptions for the employee requesting leave, will be required in order for approval in the case of COVID illness. That's not us as the school district or you as the school board. You're not authorizing that we go to the employee and say, you must show proof of vaccination. That is and I'm sorry, Corey, I keep pointing to you, that is up to the ALEA. They've determined that. Ed Minnesota said that is legal. Our attorneys say it really is their bank. The only thing we can't allow is them to use it for a sick child or sick. They have to have COVID themselves. They have to have exhausted all their leave. And the union has said, you must provide us proof of vaccination, and we will or won't approve that. That's their doing, not the school district's. And then we agree, the district agrees to that, sorry.
So if that's an internal decision, does that language even need to be in this memorandum? Why does that need to be there?
So this is for their members. So this is on behalf of their members. So their members need to know that this is the expectation. And they've decided they want that in this language. The district has not, we don't say yay or nay on it. I mean, you as the board can say, well, we're not going to, but you don't determine, we help them. They'll come to us and say, well, Johnny has asked for 30 days. Has Johnny used up all their leave? We verify that for them, but that's it. And then their group gets together. Yes, Johnny gets 30 more days. Yep, Johnny, you need to bring us vaccine. So, I mean, they want to codify this in their MOU. That's their bank.
But we need to agree to that language, correct?
Correct.
It's their bank, they can internally do what they want as far as approval and communication to the members.
Correct.
They don't need our approval on that, except if it's in the memorandum, then they need our approval on that.
Correct. Is that, any other questions on?
Just a curiosity question. So a teacher has cancer and they're fighting that. Because of the issues, they've been unable to get vaccinated. Do you have room for variance there to support because of the medical issue? I suppose that would become under the medical exemption for that?
So it has to be an FMLA qualifying event.
Okay.
And COVID illness is. And so that, if it is cancer and they've used it, now they have COVID, that again is their, so it also says religious or medical exemption. So again, we don't provide them that information. And as I stated earlier, when it comes to religious and medical exemptions, we just look for a medical provider who says, Johnny has a medical condition that is unable to wear a mask, period. Don't need to know what it is. We don't ask what it is. And we've talked with the union about that. That's how you would want to handle that.
I'm not even so sure I believe that line, and I'm going to need to check on that as well. If you were going to access this particular bank, all of those things would have had to have fallen in place. And only if you're going to access this because of COVID would that language be appropriate. But again, if you have cancer, that you're applying for it because you have cancer, not because of COVID. I think this is in addition to, it's just another qualifying deal because there are people out for weeks on end due to COVID, and it was just another qualifying factor.
Yeah, so that is the language. It says, may be used for the 21-22 school year only. The Disability Leave Reserve Bank may be used for COVID illness, proof of vaccination, subject to required medical or religious exemptions for the employee. Requesting leave will be required in order for approval in the case of a COVID illness.
It begs the question if it could be interpreted the way that Dr. Bagra was describing to us about a death certificate. If someone has cancer and they're fine at home, or they're able to manage, their daily jobs, but then they have COVID and now they're missing work, it's COVID related, not cancer related. So it's just a very complicated situation. And if the medical community is translating it that way, could it also be translated that way in this instance?
So they're very specific that it's COVID illness, and they're asking for proof of vaccination. And in our discussions, this was about a breakthrough case for somebody who was vaccinated, and we've had multiple incidents this year where staff have been fully vaccinated and have been out ill, and so they're using their leave, and so that is where they're at, is for the COVID illness. So you're looking at a positive PCR test that defines COVID illness.
But this does not apply to those who have not been vaccinated unless they qualify for an exemption? Is that how?
The union has decided you must be vaccinated to access their disability bank. Or religious or medical exemptions. And if that's the case, as I said, we kind of talked through the medical exemption. I would assist and help them walk through it. It is asking if a licensed medical provider would provide that information to them, and it would have to qualify under FMLA. Yep.
All right. Excuse me. I look for a motion to accept the MOU as written.
So moved.
Is there a second?
I'll second.
All right. All those in favor signify by saying aye.
Aye.
Aye. Oppose the same sign.
Aye.
Okay. Passes 5-2. Our next meeting will be December 6th at 6 p.m. Note the time change. It's a truth and taxation hearing. And then we'll have again a regular business meeting on Monday, December 20th. Thank you for coming.